When the world holds its breath, a look at defining historical crises. History is full of moments that make us stop and stare. Big, scary events, wars, disasters, pandemics. They shake us up, make us rethink things. They change how we live, how we think, how we see the world. These events, as jarring as they are, often reveal a lot about us. They show our capacity for both great compassion and, let's face it, spectacularly bad decisions. They force us to confront our vulnerabilities but also highlight our resilience. In this essay, we're going to dive into two of these massive events, the Chernobyl disaster and the COVID-19 pandemic. Both shook the world, but in very different ways. One, a sudden terrifying explosion, the other, a slow-burning global health crisis. Both, however, forced us to confront our own mortality and the fragility of the world we've built. Chernobyl, the day the world melted down. April 26, 1986, 1:23 a.m., Ukraine, the Chernobyl nuclear power plant. It was meant to be a routine safety test. Instead, it became a synonym for disaster. A sudden power surge, a reactor overheating, explosions ripped through the facility, tearing a hole in the reactor core. The sky above blazed with an eerie, radioactive glow. The immediate aftermath was chaos. Firefighters, many unaware of the invisible danger they faced, rushed to contain the blaze. 31 people died in the initial explosions, and from acute radiation sickness, in the following days and weeks. The Soviet Union, initially tight-lipped about the incident, was forced to evacuate the nearby city of Pripyat, a ghost town frozen in time ever since. The shadow of Chernobyl. How fear reshaped a generation. The Chernobyl disaster wasn't just a localized event, it was a global wake-up call. The invisible threat of radiation spread on the wind, reaching across Europe and beyond. Fear and uncertainty gripped the world. Governments scrambled to understand the risks, to reassure their citizens, and to implement new safety protocols for nuclear power. The environmental impact was immense. A once lush area transformed into a desolate exclusion zone. Chernobyl also cast a long shadow on the nuclear power industry. Public trust in this form of energy plummeted. Countries around the world re-evaluated their reliance on nuclear power, with some scaling back their programs entirely. The disaster served as a stark reminder of the devastating consequences of human error and the potential dangers of unchecked technological advancement. A new millennium, a new plague, COVID-19, brings the world to a standstill. Fast forward to the 21st century. The world, more interconnected than ever before, faced a new, invisible threat. A novel coronavirus, later dubbed COVID-19. It began quietly, with whispers of a mysterious illness spreading in Wuhan, China. Soon those whispers became a roar as the virus, highly contagious and often deadly, ripped across the globe. Countries went into lockdown, borders slammed shut, hospitals overflowed with the sick and dying, economies ground to a halt. The world, caught off guard, seemed to hold its breath. Unlike the immediate devastation of Chernobyl, the impact of COVID-19 was a slow burn, a creeping fear that infiltrated every aspect of daily life. The virus didn't discriminate, affecting people of all ages, backgrounds, and social statuses. Section 5. The Long Shadow of COVID, a world forever changed. As the initial shock of the pandemic subsided, the world began to grapple with its long-term consequences. The human toll was staggering, with millions of lives lost and countless others forever altered by the virus's debilitating effects. The pandemic exposed and exacerbated existing social and economic inequalities. Healthcare systems, already strained, were pushed to their breaking points. The education of an entire generation was disrupted, with schools forced to adapt to remote learning models. The mental health impact of the pandemic was profound. Isolation, fear, and grief took their toll. Trust in institutions eroded as misinformation and conspiracy theories flourished in the digital age. The pandemic forced us to confront uncomfortable truths about ourselves and our societies, revealing both our strengths and our vulnerabilities. It highlighted the interconnectedness of our world, demonstrating how quickly a crisis in one corner of the globe can reverberate across the planet. Section 6. Echoes of disaster parallels between Chernobyl and COVID-19. Though separated by decades and vastly different in nature, the Chernobyl disaster and the COVID-19 pandemic share some striking similarities. Both events exposed the fragility of our systems and the devastating consequences of unpreparedness. Both crises highlighted the importance of clear and transparent communication from those in power. The Soviet Union's initial attempts to cover up the Chernobyl disaster only amplified fear and distrust. Similarly, misinformation and mixed messaging surrounding COVID-19 fueled anxiety and hindered effective public health responses. Both events also underscored the critical role of international cooperation in addressing global challenges. The Chernobyl disaster led to greater collaboration on nuclear safety standards, while the COVID-19 pandemic prompted unprecedented efforts to develop and distribute vaccines and treatments. Perhaps most importantly, both crises served as stark reminders of our shared humanity and our responsibility to protect one another. Technology in the face of fear, from Geiger counters to contact tracing apps. Crises often serve as catalysts for technological advancement. After Chernobyl, demand for radiation detection instruments soared. Geiger counters became widely available for monitoring radiation. Similarly, COVID-19 accelerated tech development. Contact tracing apps tracked virus spread, raising privacy concerns. Telemedicine grew as providers delivered remote care. Section 8. Unity and Division, Global Responses to Crisis, Then and Now. Crises reveal both the best and worst of humanity. After Chernobyl, the world showed compassion and support. Organizations and individuals provided aid and medical assistance. The COVID-19 pandemic presented a complex picture. There were heartwarming examples of cooperation, but also exposed divisions and competition for resources. Disinformation and xenophobia emerged, as some exploited the crisis for political gain. The pandemic reminded us that unity is not a given. Section 9. The Power of Transparency, Lessons from Chernobyl's Information Blackout. One of the most significant lessons learned from the Chernobyl disaster was the importance of transparency and open communication during a crisis. The Soviet Union's initial attempts to downplay and conceal the severity of the disaster only served to sow distrust and hinder effective response efforts. By the time the true extent of the disaster became clear, valuable time had been lost, and the credibility of the Soviet government had been severely damaged. The Chernobyl disaster highlighted the need for governments to be forthright with their citizens, even when the news is bad. The COVID-19 pandemic, while not marked by the same level of deliberate obfuscation, also underscored the dangers of misinformation and the importance of clear, accurate, and timely communication from trusted sources. The rapid spread of misinformation and conspiracy theories online highlighted the need for critical thinking skills and media literacy in the digital age. Section 10. Preparing for the Unthinkable, Building Resilience for Future Crises. Both Chernobyl and COVID-19 taught us the importance of preparedness. We can't predict the future, but we can learn from the past. We can build more resilient systems, invest in scientific research, and strengthen our capacity to respond effectively to future crises. The Chernobyl disaster led to improvements in nuclear safety protocols and a greater emphasis on international cooperation in the field of nuclear energy. Similarly, the COVID-19 pandemic highlighted the need for robust public health infrastructure, pandemic preparedness plans, and global coordination on disease surveillance and response. These crises also underscored the importance of investing in social safety nets such as universal health care, paid sick leave, and affordable housing to mitigate the impact of future shocks. Building a more resilient and equitable world requires addressing the underlying vulnerabilities that exacerbate the effects of crises. Section 11. A Legacy of Change, How Shared Trauma Shapes the Future. Historical crises, as devastating as they are, often leave a lasting legacy of change. They force us to confront uncomfortable truths, to reevaluate our priorities, and to imagine a different future. The Chernobyl disaster spurred a global anti-nuclear movement, leading some countries to abandon nuclear power altogether. It also highlighted the devastating environmental consequences of unchecked technological advancement. The COVID-19 pandemic, though still unfolding, has already reshaped our world in profound ways. It has accelerated trends towards remote work, online learning, and telemedicine. It has also exposed the fragility of our global supply chains and the need for more resilient and sustainable systems. Perhaps most importantly, both crises have forced us to confront our shared humanity, reminding us that we are all connected and that our actions have consequences that extend far beyond ourselves.